Well, a large group of doctors and scientists say the Summer Olympics should be postponed or moved out of Brazil due to the Zika virus. The warning came in a letter addressed to the World Health Organization. The mosquito-borne virus can cause extreme birth defects. Brazil is considered the epicenter of the Zika outbreak. The Summer Olympics are set to get underway in Rio in August. Our CNN's Ivan Watson is following this story and joins us now from Rio. Ivan, these doctors and scientists are from some of the most recognised universities in the world, Oxford, Harvard, Yale. What did they say in their letter to the WHO?
Not just to the WHO, but also to the Center for Disease Control, a direct challenge, basically, to both organizations, saying that the Olympics have no business being held here when they're supposed to start in Rio in August, that they should either be postponed or moved to another venue, because they argue that the mosquito-borne Zika virus presents a potential global health risk. There's simply not enough known about it, and they argue that if 500,000 tourists come from around the world here, then some of them can contract the disease and bring that back to their home countries, and especially in the event that some of those countries are poorer, are third world countries that have poorer health infrastructure, that could then potentially do great damage to those communities and societies. The World Health Organization has since fired back, saying that they argue that there is no legitimate reason for postponing or moving the games. They say that they're working closely with the Olympic Committee, with the Rio authorities to try to battle the mosquito that spreads the disease. And they also stand by their health advisory, which is basically pregnant women should not come here for the Olympics. People should use condoms and practice safe sex, since the virus can be transmitted through sex. And they're also advising people to wear mosquito repellent, stay in places with air conditioning, and stay away from poorer areas of the city which don't have very good sanitation, which have more open water. But I've got to tell you, where I'm standing, we're close to a canal here that reeks of raw sewage. That is one of the main problems facing this city: raw sewage, open water, poor sanitation. And even a taxi driver that I traveled with yesterday told me his sister had contracted the Zika virus. So this is a threat here. Linda.
So even if those 500,000 people follow all the precautions that the WHO has told them to follow, there is still the chance that they probably will get this virus. Some of them will get this virus. What's the likelihood people who contract the virus in Brazil will take it home, back home to their home countries?
That is the fear. That is the question that is being raised by this group of 150 doctors and medical researchers in their open letter. But you know, Brazil doesn't just deal with the Zika virus, which is more recent, which has attracted headlines and more recent research. This is also a city that's been battling with other mosquito-borne diseases, such as dengue fever, yellow fever. Those are diseases that can have much more dramatic symptoms when people first contract the disease. So these are all health concerns that ordinary Brazilians deal with every day in the city, health concerns that people need to be aware of, both the athletes and the tourists and the audiences when they come and visit this city in August. Linda.
Okay, Ivan Watson for us live from Rio. Thank you very much for joining us. And earlier I spoke to a spokeswoman from the World Health Organization. Take a listen to what she had to say.
They're asking us to look at the risks we have, and what we know is that the 1 million people who travel around the globe every day are what are contributing to the spread of Zika. Mosquito patterns are what are contributing to the spread of Zika. The idea that stopping 500,000 people from attending one event would stop the spread of Zika is very attractive, and it would be wonderful if that would work, but it just won't work.
Although 500,000 people, as you say, are going to the games in Brazil, which is ground zero for the virus, where they could return to their home country where it could be endemic. What are the risks for people who contract this virus and take this virus back to their home country?
The fact is, and we sometimes forget it because we're so focused on Brazil, the fact is that Zika has already affected 60 countries, including poorer countries, including better developed countries. So it's already spreading around the world, and that's what we expect to see with the heating temperatures heating up in the U.S., in Europe as well. The mosquito populations will be coming up again, and we estimate there's a risk that we'll start seeing it in those European countries. So there's absolutely risk, and that's why it's so important for people to take the measures to protect themselves. It's also why we are working closely with local officials, with Brazilian officials, with officials in Rio, to make sure that their local populations are protected as much as possible against Zika, as well as visitors, tourists, and athletes. But it's a really tough time, and there'll be some very difficult decisions for some athletes to make.
So you don't think the risk will be heightened by going ahead with the Games?
The reason it won't is that that international travel happens every single day. So there's no heightened risk from that particular gathering of people any more than there is from daily travel. Daily travel does increase our risk, but that's the reality we live with now. That's the globe we have now. People travel across the world every day, including to and from Brazil and the other 59 countries that are affected with Zika.
That was the WHO spokeswoman, Nyka Alexander. Well, still to come on CNN Newsroom, time is running out for investigators searching for the black boxes from Egypt Air Flight 804. Plus, a ghost town in Greece is all that's left of a community that once boasted a cultural centre and a barbershop. Our correspondent shows us the toll the migrant crisis is taking.